If your eyes are constantly dry, your mouth is always parched, don't just assume it's normal. It could be the first sign of a silent attack from within your own body, a disease you've never heard of, but is quietly taking the health of millions of people every day. Sjogren's syndrome. It doesn't hurt. It doesn't cause fever. It doesn't cause alarm, just mild dry eyes, a temporary dry mouth, a little fatigue. But behind that harmless disguise is a full-blown attack on the tear ducts, salivary glands, heart, lungs, kidneys, and the central nervous system. What's more dangerous is that more than 4 million Americans are living with it without even knowing it. And among them, it could be you or someone you love. You're thinking, maybe it's because I work too much on the computer. You're thinking, it's just a lack of water. Don't be mistaken. It could be your body's last cry for help before it's too late. In this video, you'll learn the first 15 signs of Sjogren's syndrome, and one of them could be a warning sign of a deadly blood cancer. Don't miss the video, because symptom 14 is something that even doctors sometimes overlook. But you can't miss it. Are you one of them? The answer could change your life at the end of this video. And now, let's begin our journey to discover the truth behind Sjogren's syndrome. With the first symptom, a feeling that is frighteningly familiar to many. Symptom 1. Dry eyes. Feeling like there's sand in your eyes is not normal. Imagine waking up every morning, opening your eyes and feeling like they're covered in fine sand. Burning, gritty, itchy, making you rub your eyes constantly. This isn't just computer eye strain. For people with Sjogren's, it's a daily headache. The lacrimal gland, the place that produces tears, is attacked by the immune system, causing the amount of tears secreted to no longer be enough to protect the eyes. And the danger lies in this. Tears are not just water. They contain oil, mucus, antibacterial, anti-inflammatory, a biological armor that protects the cornea. When this tear film is broken, the eye surface becomes exposed, vulnerable, susceptible to infection, and gradually fades over time. 2024 study found that Sjogren's patients have significantly lower levels of lactoferrin, an important anti-inflammatory protein in tears, than normal people. This deficiency means that their eyes are not only dry, but also more susceptible to severe inflammation. If you regularly experience dry, red, light-sensitive, or transient blurred vision without any apparent reason, don't blame your phone or air conditioning. It could be the first warning sign that your immune system is going haywire. Symptom 2. Dry mouth. When your mouth becomes a desert, do you often feel the need to carry a bottle of water with you when you go out? Do you have a dry throat, difficulty speaking, or even a piece of dry bread? For people with Sjogren's, it's a daily experience. Dry mouth is more than just an inconvenience. Saliva is the river of life, neutralizing acid after eating, fighting bacteria, digesting starch, and helping you speak fluently. When the salivary glands are damaged, these functions are all impaired. A study of more than 1,400 people with Sjogren's found that 87% experience dry mouth regularly, but nearly 75% never told their dentist. This is scary because they are ignoring a very important symptom. When saliva is depleted, the mouth becomes an ideal environment for bacteria to grow. The result is what you are about to read in symptom number 3. Symptom 3. Tooth decay and gingivitis. The devastating consequences of dry mouth. Saliva is antibacterial and neutralizes acid. When it is gone, criminals like tooth decay and gingivitis bacteria have a chance to rise up. Think of it like this. Your mouth is a city, and saliva is the police and the garbage disposal system. When this force disappears, the gangs of bacteria take over your teeth and gums, attacking the enamel, causing inflammation, bleeding gums, and eventually, permanent tooth loss. A 2024 study confirmed that Sjogren's disease not only causes dry mouth, But its autoimmune mechanism is the root cause of rapidly deteriorating oral health. Oral care for people with Sjogren's is no longer a should, it is survival. From brushing your teeth after every meal, to using moisturizing gels, specialized mouthwashes, and regular dental visits, all become indispensable parts of a comprehensive treatment regimen. Symptom 4. Recurrent sinusitis. Don't blame the weather. Do you have a stuffy nose, forehead headache, or persistent runny nose? How many rounds of antibiotics have you taken and still not cured? You may not have a cold. You may have chronic sinusitis due to Sjogren's. When the lining of the nose loses moisture, the mucus in the sinuses becomes thick. The cilia are no longer flexible enough to sweep dust and bacteria out. The sinuses become stagnant air pockets, where bacteria thrive and cause infections. A large 2022 study found that people with Sjogren's are 2.5 times more likely to develop chronic sinusitis, especially due to hard-to-treat bacteria like Pseudomonas aeruginosa. If you feel like you have recurring sinusitis, don't just think about nose drops or antibiotics. Think about the root cause, your immune system. Symptom 5. Photosensitivity. Sunlight is also an enemy. Do you feel hot, red, or rash after just 5 to 10 minutes in the sun? It's not because of thin skin or weather allergies. It's because your immune system is misreacting to UV rays. A study of 14 Sjogren's patients exposed to UV light found that 11 had severe skin reactions, even lupus-like symptoms. The body no longer processes sunlight like a normal person. It overreacts, attacking the skin cells that have just been stimulated by UV rays. It's not just sunlight. Fluorescent lights, nail salon lights can also cause skin damage in people with Sjogren's. So if your skin is itchy, rashy for no apparent reason, think beyond allergies. Your immune system may be doing something it shouldn't be doing. Symptom 6. Esophagitis and dysphagia. When a simple action becomes painful. Have you ever felt a choking, burning sensation when swallowing a mouthful of rice or a sip of water? Many people think it's due to dry mouth, but the truth is more complicated. It could be acid reflux esophagitis GERD, and it's especially common in Sjogren's patients. GERD and Sjogren's have a strong two-way connection. People with Sjogren's are more likely to develop GERD due to a lack of alkaline saliva. People with long-term GERD are also at higher risk of developing Sjogren's syndrome due to chronic inflammation that triggers autoimmune reactions. A 2024 study using Mendelian randomization confirmed there's a biological link between the two conditions. If you have difficulty swallowing, heartburn, or esophageal pain, don't take it lightly. It could be part of the bigger picture your body is painting of a full-blown immune disorder. Symptom 7. Increased risk of lymphoma. A silent but real threat. Not everyone with Sjogren's gets cancer. But if you know that, the risk of lymphoma in people with Sjogren's is 10 to 48 times higher than normal people, you will understand why this is the most dangerous complication. When the immune system is tricked, B cells, which are used to produce antibodies, are constantly stimulated, dividing disorganized. And when mutations occur, lymphoma can form, especially the MALT type in the salivary glands. Some early warning signs include persistent, hard swelling of the salivary glands, lymph nodes in the neck, armpits, or groin that do not go away, fatigue, weight loss for no apparent reason. If you're living with Sjogren's, regular testing and close clinical monitoring are key to keeping a safe line between chronic inflammation and malignancy. Symptom 8. Interstitial lung disease, ILD. When breathing becomes a battle, do you ever feel out of breath climbing a few flights of stairs? Or have a persistent, unexplained cough? Chances are, it's not age, it's your lungs being attacked. Interstitial lung disease, ILD, is a dangerous but little-known complication of Sjogren's. The interstitial tissue in the lungs, where gas, Exchange occurs, becomes fibrotic, thickened, and loses elasticity. Difficulty breathing and chronic fatigue are direct consequences. A 2023 study found that ILD may be the first sign of Sjogren's in many people, even before dry eyes or dry mouth. High-resolution CT scans of the lungs and pulmonary function tests can help detect early. So if you have a persistent cough or are short of breath, consider it a sign to act immediately. Symptom 9. Kidney damage. When silence becomes a big threat, no one would think that the kidneys, an organ that does not produce saliva or tears, are affected in Sjogren's. But the truth is, the immune system can attack the interstitial tissue of the kidney tubules, causing a condition called TIN, interstitial nephritis. The initial symptoms are very silent. Frequent urination, nocturia, electrolyte disturbances, fatigue. Only when blood or urine tests are abnormal do people detect the damage. A 2025 study found that 2.8% of Sjogren's patients have kidney damage. Of these, nearly half have signs of kidney failure at follow-up visits. And more worryingly, the rate of leukemia is higher in this group. This underscores the point that regular kidney function testing is an integral part of a comprehensive treatment plan. Symptom 10. Skin rash. Skin is not just beautiful or ugly, it also tells the story inside. Do you notice your skin itching, unusual rashes, or redness that lasts after sun exposure or for no apparent reason? In people with Sjogren's have dry skin, and many others have tiny purpura, mosquito bite-like spots, urticaria, itchy rash, erythema nodosum, painful rash on the lower legs. These are often associated with inflammation of small blood vessels and indicate active disease. Don't take rashes lightly. Take a picture, monitor them, and report them to your doctor. Your skin is the face of your immune system. Symptom 11. Brain fog. When your mind goes dry, have you forgotten where you put your keys? Can't remember what you were saying? Can't concentrate on a paragraph? It's not just fatigue, it's brain fog, a common symptom experienced by 75% of Sjogren's patients. Feeling confused, losing focus, having difficulty expressing ideas, all stem from mild neuroinflammation and the effects of autoantibodies on the brain. fMRI images show areas that control memory and attention, such as the frontal gyrus precuneus in patients, are significantly less active. This is a real sign, not mental weakness as many people have misunderstood. Symptom 12. Vaginal dryness. The silence that makes many women suffer silently. This is a symptom that is rarely talked about, but has a big impact on quality of life and intimacy. Vaginal dryness, pain during intercourse, prolonged itching and burning are direct consequences of the vaginal moisture glands being attacked. 2024 study showed interferon signals, which should only appear when there is a virus, are highly active in the vaginal mucosa of Sjogren's patients, causing chronic inflammation. The good news is that there are many ways to help, from moisturizing gels, topical estrogen, to systemic hormones. The most important thing is not to be afraid to speak up, to get timely support. Symptom 13. Chronic headaches, not just stress. Many people suffer from tension headaches or migraines that last for a long time, and medication doesn't help, without realizing that it could be related to Sjogren's. Inflammation of the small vessels in the brain or mild nerve damage can cause severe, recurring headaches that can have a big impact on your life. If you have a headache accompanied by dry mouth, dry eyes, or brain fog, don't just reach for painkillers. Look at the big picture. Symptom 14. Autonomic dysfunction. Your body. Loss of control from within, rapid heartbeat when standing up, lightheadedness, irregular digestion, unusual sweating. All can be signs of dysautonomia, autonomic nervous system disorder. In Sjogren's, the immune system attacks the small nerve fibers that control heart rate, blood pressure, temperature, digestion, etc. causing the body to lose its auto-regulator. This symptom is often mistaken for an anxiety disorder. But the truth is, it has a real physiological mechanism and needs to be treated properly. Symptom 15. Peripheral nerve damage. When the feeling in the hands and feet is no longer normal numbness, tingling, burning in the hands and feet, muscle weakness, slight tremors. All are signs of peripheral neuropathy, affecting nearly 20% of Sjogren's patients. The nerves that transmit signals are inflamed and degenerated, leading to loss of sensation and loss of control of fine movements. Early diagnosis with electromyography, EMG, biopsy, and treatment with immunosuppressants can prevent the damage from spreading. Conclusion. This is how you take back CONTROL if after watching this video you feel a little anxious or weighed down. That's completely normal. In fact, it's a good sign, because that feeling isn't fear. It's awakening. And you find yourself in any of the above symptoms. Don't ignore it. It may not be just fatigue. It may not be just dry eyes or dry mouth. It may be a silent cry for help from your immune system. Take action. Record the signs you are experiencing. Make an appointment with a specialist. And don't hesitate to share this video with your loved ones, because sometimes just one timely piece of information can change a life. If you find this video useful, hit the subscribe button and turn on the bell, so you don't miss out on knowledge that can protect your health and longevity. Thank you for taking the time to watch. Always listen to your body and take good care of your health. See you in the next video.